Well, good afternoon, everyone joining this webinar. My name's Jim Plump. I serve as secretary of the Schneck Foundation Board, and it is my pleasure to welcome you to this 1-hour webinar. We're joined today by Dr. Eric Fish, MD, President and CEO of Schneck, along with Dr. Matthew Wilson, Medical Director, Family Medicine Physician, and Kelly Franklin, Director of WellLife by Schneck. Just a couple of housekeeping items before we get started. This is a recorded session, and we will start here in just a second with comments from Dr. Fish, and then we'll move on to the presentation by Dr. Wilson and Kelly. I would also ask during the presentations, if you have any questions, please use the Q&A button on your screen. And once we finish, we will go through those questions and have those answered. So without further ado, it's my pleasure to introduce Dr. Eric Fish, President and CEO of Schneck Medical Center. Eric?
Thanks, Jim, and appreciate that, and appreciate everyone being involved today in the roundtable discussion. Appreciate Dr. Wilson taking time out of his day, as well as Kelly. Appreciate everything everybody does and has done for the organization over the especially the last couple of years. And I think what you'll find with this presentation will be very value added. And again, I just want to thank everyone for being on here today. And as Jim said, this is recorded, so have an opportunity to go back and to share as well. So, and also just a shout out to the foundation for the great work they continue to do and for putting this all together, Stephanie Flynn and her team. So Jim, I'm going to turn it back to you, and appreciate you leading this as well.
All right, thanks very much, Eric. And as I said earlier, really want to turn it over now to Kelly and Dr. Wilson. They have some prepared remarks and some information to share with those of you on the webinar. Kelly, I'll let you kick it off.
Okay, I'm going to share my screen here. One second, let me find this. Here we go. Can you see my slide deck okay? Yeah, okay. Okay, well, good afternoon. Thank you everyone for joining us. WellLife by Schneck is the Schneck's physician practice devoted to carrying out the mission of improving the health in our communities by partnering with employers and their employees. As you can see on this slide, there are 3 service lines within Schneck, within WellLife by Schneck. The first is our on-site wellness services. The second is our contracted primary and urgent care services. And the third is our occupational health service line. The foundation of all 3 of these services is lifestyle medicine. So lifestyle medicine is the practice of reversing chronic disease through lifestyle changes. So this might be dietary changes, increasing physical activity, improving sleep, among other things. Our providers at WellLife meet the patient's needs with necessary medications for chronic illnesses, but we do allow additional time with providers so they can coach our patients on those lifestyle changes to improve their chronic conditions. So today I will dive into each of these 3 service lines, and Dr. Wilson will discuss what sets us apart and makes us unique in the employer clinic market. First, our contracted primary and urgent care services. So there's 2 methods to contract with us. The first is through your SIHO health plan. We currently have 62 employers contracted with us through their SIHO health plan. When we partner with SIHO on these memberships, everyone on the employer's health plan has access to WellLife, and then we receive that access fee through the SIHO plan. The second avenue is a direct contract with WellLife. It's generally a one-year contract. And at the beginning of each month, an employer will provide to us a list of their employees and dependents that have access to the clinic and pay the per member per month access fee. This is a customizable plan. So we have employees that employers that want everyone on their health plan to have access to WellLife. Some just do their employees only, and then some allow their employees and spouses to have access to the clinic. On this slide, I've listed the healthcare services that can be provided at WellLife. Essentially, it's the same services that can be conducted at a primary or urgent care type facility. The most common appointment types are listed here on the left-hand side. Our highest volumes are generally those acute minor illnesses, but we still do have a large patient population that prefer to use us as their primary care clinic. And we work with them on chronic disease management, any type of physical that they might need. Additionally, we know that it is important to our employers that their employees can be seen same day. So we do monitor that very closely. We also have a walk-in model for those acute minor illnesses. Additionally, through the contracts, we have an on-site pharmacy. So we have over 30 prescriptions that can be given to our patients. It's free to those patients on a traditional plan, and there's a minimal fee for those patients that have an HSA plan. We also have 25 lab tests that are available to our patients. It is free, again, if they're on that traditional health plan, and then there's a minimal cost if they are on an HSA plan. Keep in mind, those labs and prescriptions have to be ordered by a WellLife provider just to ensure that we are providing the highest quality of care to our patients. And last, we offer marketing support. So this is really customizable by employer. This might be, videos or flyers that we can put in break areas. It could be newsletters to put in break areas or to put on online portals sent via the employer's text messaging system. It's really whatever. I work with the employers to develop what kind of marketing support is best for their employee population. Also, as part of marketing, oftentimes I will attend benefit open enrollment meetings to talk about WellLife access and the benefit of the employer's employees, dependents, and spouses visiting the clinic for support. And then last, we are able to offer utilization reporting. And so this is a way that we report the volumes of services, prescriptions, and lab tests that have been utilized each quarter, or whatever cadence that we set up with the employer. The next service line is our occupational health services. And so we transitioned occupational health services to WellLife in March of 2020. At that time, all of our clinic staff, along with myself, our providers, received training through the National Association of Occupational Health Medicine, the American College of Occupational and Environmental Medicine, and the American Association of Occupational Health Nurses. In fact, we're very proud that one of our WellLife providers has been accepted into the program to become a certified occupational health nurse through the AAOHN. With that said, we feel pretty confident in partnering with employers for occupational health services. On this slide, on the left-hand side are our condition of employment services. So our highest volume is actually our urine drug screens, and we offer those for pre-employment, post-accident, and random screenings. Those can be conducted through the eScreen portal, the employer's contracted MRO, or WellLife has a contracted MRO that we use. So those drug screens can be conducted any of those three ways. We also do condition of employment exams such as DOT physicals, pre-employment, and respiratory fit exams. We also have all of our staff is trained to do breath alcohol testing and audiograms. Moving on to workman's compensation. So we have found that this is a true partnership with employers. We currently to date have 51 employers that we've partnered with. Our ideal model and partnership starts with an on-site visit to employers from my provider team and clinic leadership. This gives us a very good idea of the job expectations and work environment when we treat these injured or injured patients. It is not required, but at the bare minimum, we like to have a phone call with each employer that we establish into a partnership for work comp, just so we can discuss things like restriction accommodations, most common type of injuries, their current mod rate, their recordable history, and just discuss our detailed process. So after every visit, patient visit, we do send a verification form with the employee or our patient. It's sent to the employer, and it's also sent to the work comp case adjuster. So our verification form is very detailed and leaves no room for question as to what happened or what the care plan is for that patient. But if there are questions, one thing we will establish up front with our employer partners for work comp is that if they can call us at any time. Oftentimes my providers will return a call to an employer contact or a safety department. So know that it is a true partnership, and our aim is to leave no question about the treatment plan for the patient. The third service line within WellLife is our on-site wellness services. So these services exist to assist our employer partners in preventing disease and illnesses through these preventative services. These are the most commonly requested services, but it is certainly not an all-inclusive list. We partner with employers to do annual biometric screenings that generally include a comprehensive blood analysis, blood pressure screening, and height, weight, and BMI. So after the biometric event, then we send the aggregated report to the employer. Partnered with a biometric event, we also can offer a health risk assessment. With the results of the HRA and the biometric screening, we are able to design, or I guess it gives us the capability to tell that employer what type of wellness initiatives we would recommend. And then we allow them to, or we partner with them rather, to determine what is best for their employee population. One thing that we would like to do more of in the future is use claims data from the employer's health plan. If we had claims data and we can utilize that, the biometrics data and the health risk assessment, we feel that it would give Dr. Wilson and our provider team and I an opportunity to partner with that employer to develop a menu of services that can be done by group classes. It can be done virtually, one-on-one through health coaching, but this might be things like targeting a diabetic population, or maybe they have a low participation in preventative screenings. So really just gives us an opportunity to roll those wellness and preventative services out. Our team can also, as I mentioned, conduct health coaching on site, and then every year we partner with multiple employers to offer vaccinations. At this time, I'll turn it over to Dr. Wilson to discuss the benefits of the care coordination within Schneck.
So the benefits of care coordination is really all about patient continuity of care and patient satisfaction. So I'll give a workman's compensation as an example. Say someone becomes injured at work and they go to ABC Urgent Care Clinic in Columbus, because that's where the employer has sent them to get care. Then after they received their examination and the plan, they needed to go to an orthopedic surgeon for further treatment and management of their injury. Now, the problem that can come up with that is if they go to ABC Clinic and then the carrier sends them to Schneck Orthopedics, there's kind of a disconnect in the communication that can happen. So the advantage of coming to WellLife is that we're all Schneck. And so if they see a WellLife provider, they're able to easily communicate. The provider is able to easily communicate to, say, orthopedics, the findings and the plan of care and any other further management, without having to send faxes, phone calls, etc., because we're all underneath the same electronic medical record system. That being said, also is we are a very collaborative and collegial group within Schneck Medical Center. So once any of the providers from WellLife try to send an employee over to orthopedics, we can simply pick up the phone and call the surgeon and discuss the case with them. Anything that we may need to do in the meantime while they're waiting to see that orthopedic surgeon, whether it be splinting, medications, what kind of restrictions does the patient need? I think that's a real advantage over them being seen outside of Schneck for their workman's comp. The other thing is we can also try to work in a patient maybe a little bit faster when it's within our own system because of that ability to have that communication. To me, I mean, those are the huge benefits of the care coordination is continuity of care, expeditious treatment without delay with waiting to get into a specialist. And then so you lose work hours with your employee if they have to wait 2 months to go to an outside facility versus if they come to us and we can get them into our orthopedics within a month. And then also your employees will be much more satisfied with the ability to hopefully get back to work sooner rather than waiting on these evaluations and management of their care. I don't have anything else to say about care coordination. So I think Kelly had a couple of other things to mention, and then we'll do care questions.
Yeah, I just want to thank everybody for their time today. Here is my contact information. And I think at this time, we'll just turn it back to Jim and take any questions that our participants may have.
Yeah, as we said earlier, excuse me, people on this webinar, any questions, just use the Q&A tab and we will get those answered as they come in. I guess as we're waiting for some questions, Kelly, can you talk a little bit about what are the hours of operation and where is WellLife actually located?
Sure, yeah. So we do have extended hours. We know that a lot of our patients work a second or third shift. So Monday and Wednesday, it is 8 a.m. to 6 p.m. Tuesday and Thursday, 7 a.m. to 6 p.m. and Fridays, 8 a.m. to 4 p.m. And we are located in Seymour at 100 North Walnut Street. Right across the street from the Jackson County Library.
Do businesses need to pre-qualify to sign up? And if so, what's that process?
So for our contracted primary and urgent care services, yes, they do need to reach out to me, and we can discuss what all really what services that they want within their contract. Essentially, the services that they want will determine what that per member per month fee is. So they should reach out to me to establish that contract. For our occupational health services, we do take those walk-ins. If we haven't established just a partnership with the employer, we will call the employer contact to get information about preferred MRO. If there's details about the work comp patient that we need to know, we'll call them when the patient arrives. And then for the on-site services, same, they just reach out to our clinic or myself, and we'll talk through what services they would like.
You know, you mentioned on-site. I guess will WellLife go to individual companies, individual users, or talk a little bit about, you know, how that would work?
Yeah, we certainly will. We often do biometric screenings. We've talked to some of our employer partners about doing on-site drug screens and on-site respiratory fit exams, and we do have transportable equipment where those type exams can be conducted.
You know, I know Dr. Wilson, you know, you'd kind of mentioned the umbrella, if you will, of Schneck, the benefits of, you know, getting in early on this, but what else or what really sets, you know, WellLife apart from other wellness clinics?
Like I said, it's really about the camaraderie and the collaboration that I see between our providers in the WellLife clinic with all the other specialties within Schneck that a patient may need to see for their further care. And to me, when you have a continuity of care and a lot of communication ability and collegiality between the providers throughout Schneck, it really reflects in the patient's care, and the patient is satisfied, the employee is satisfied, and then with the employee being satisfied, the employer has a lot of satisfaction as well.
Kelly, is there a number? Do companies have to be a certain size in terms of small, large to qualify for these services?
No, we have contracted employers that have 2 employees up to over 800. So no, there is no minimum or max.
I guess we've answered a few of the questions that have come in. You know, we may wrap this up a little early today, but I guess, you know, Kelly, if you would again share contact information about how they can reach you and the process, and maybe just kind of walk our participants through that maybe one more time.
Yeah, sure. Let me just share my screen one more time, because I know I like to See it. So my direct number is 812-522-0138. That's the best way to reach me, or by email. My email is listed there. You can also visit our website, welllifebyschneck.com. But yeah, the best way just to get those conversations started on specific services that you might be interested in is either by phone or email.
Okay, final comments, Kelly. Really good information from you and Dr. Wilson in terms of what WellLife is all about. So maybe just a final comment from each of you.
Sure, yeah. So I've been with WellLife by Schneck for 4 years. I started in 2018, and I think that what I've seen over the past 2 years, as the pandemic sort of, yes, I don't know what it normalizes, and the recession is, we're still trying to figure that out. And then I think when I talk to employers, they have a lot of concerns about staffing and retention, right? And so in full transparency, Jim, I think that WellLife by Schneck, we're evaluating and we are trying to figure out how best to partner with employers now. Because a lot has changed over the past 2 years, right? And so I think my closing statement is just, if there is something that you're interested in, I've discussed the 3 service lines that WellLife by Schneck can offer the community, but I think it's not, that's not an all-inclusive service line, right? Like, I think that if there's something that an employer needs or wants, I would encourage them to reach out to me to see if it's something that we can partner together on.
Yeah, I'm hearing communication is really kind of the where you start to pick up the phone, call you, and have the companies, talk about services that they are interested in, and if that something that WellLife can provide, and how that whole process needs to get started.
Right. Correct.
Dr. Wilson, final comment today.
Thank you. I just wanted to say that I've been involved with occupational health before I was with WellLife by Schneck. I started with WellLife as their medical director approximately 1 year ago, and I've been a family medicine physician with Schneck for 2 years. When I was in the military, I was also a director of an occupational health clinic in Texas. And when I compare the two in my own mind, I feel like the WellLife Occupational Health Clinic, or WellLife by Schneck, is a much more well-oiled machine. I'm very impressed with the level of care that the providers at WellLife provide to the patients and the employees, and I'm very happy with how things are unfolding as this pandemic starts to wind down, hopefully, over the past year. If you do have any other questions, medical type questions that Kelly would not be able to answer, she will gladly forward those emails or phone calls to me. Or if you have any other questions about this webinar, please feel free to ask them. I'm available almost all the time.
Okay, well, certainly, Dr. Wilson, we appreciate you making time today to participate, and obviously, Kelly, thanks for your information, good information that hopefully the participants found very useful. Again, Schneck Foundation is pleased to present events like this to get information out to the community. And again, would encourage those that would have questions to call Kelly and see how WellLife, can help your business, and more importantly, help your employees and associates. So with that, having answered most of the questions, again, Kelly, thank you very much for your time. And again, also Dr. Wilson, Eric Fish as well. Hope everyone has a good rest of the day.
Thank you, Jim.